So, as a matter of fact, we developed and validated with 2 papers already printed and another paper that is in press, accepted for publication, so should come out shortly. This technique that is based on ultrasounds that allows direct visualization of brain structures and precise assessment of brain inflammation. Something that can already be done with SPECT or with magnetic resonance, of course, but this technique has the advantage of its simplicity, of its inherent safety, and the easiness how you can do it. So it's non-invasive, safe, well-tolerated, and ready. Yesterday night we had fun playing with the eco machine until about 11 p.m. and those of you who were there saw how easy and how simple it is. And in the future, hopefully, it will be instrumental in assessing the degree of brain inflammation and in monitoring the effects of any therapy, including, of course, Gcmaf, in a variety of those chronic diseases, from autism to CFS to neurodegenerative disorders and cancer, where the systemic and the brain inflammation play a part. Please consider that, again, when you deal with cancer, of course, your principal enemy is the cancer in itself, but the organism is responding to the cancer with a diffuse inflammation, and to decrease the diffuse inflammation is something beneficial in any case. Now, in this specific case, we could distinguish, and if you wish in the afternoon, I can show you on myself. We just can connect the eco machine to the projector and show you how easy it is. So we could distinguish the meninges, the subarachnoidal space, and the cortex. Then, knowing a little bit of neuroanatomy, we could direct the ultrasounds in those areas of the temporal lobe that were designated by von Economo as TG and TE, or they also have other designations in numbers, and are those areas that are involved in the control of eye movement. And when I say eye movement, I guess that all those who are interested with autism, they understand what I'm talking about. Balance in the standing position, social behavior, no need to explain the importance of social behavior in autism and in CFS, mood, decision-making area, this is the area TG. And of course, we all know that these areas are affected or control those functions, to be more precise, that are affected in a number of diseases from autism to CFS. Now, this is a review that was published just a few months ago in November 2012 in Nature. There was an issue on autism. So here on only 7 participants. So we all appreciate clinical record, clinical cases and of 1,000 participants and double-blind randomized clinical trials. In Nature, they're content with 7 participants. So sometimes observation of small numbers, they could be very significant. In any case, in this case, they use functional MRI to demonstrate that these areas in the temporal lobe, like the insula or the superior temporal cell site, are activated or they have abnormalities in autistic children. So please memorize this area, this one here and this one here, that control all these functions, because those are the areas that you will be able to see now in the slide, if you wish in the afternoon on yourself or on myself, as you like, with the ultrasonography. Of course, these areas control these functions. So this is me in one of the first attempts that we did. So this is the common ultrasonography machine that can be present in any medical practice. And here I'm directing the ultrasounds in those areas that I was mentioning before. So you need a little bit of knowledge of neuroanatomy, otherwise you don't know where you are directing the ultrasounds. That's not like MRI, where you recognize the structures at first glance. So you can see the skin and the subcutaneous fat. This is the outer, this is outside, this is the inside. No, I made a mistake, but I should be. Okay. So this is my skin, my subcutaneous fat, This is my temporalis muscle. I can check that it is it because I can contract it voluntarily and see. This is my temporal bone or temporal squama, which is about 1 millimeter something. These are the meninges. This track here is the subarachnoidal space with the liquor. By the way, with this technique, you can have an idea whether you have enough liquor or not, which in turn reflects general condition of hydration of the patient. And from here to here, you have the temporal cortex. What can you do with these images? Well, you can enlarge them using the software that is provided with the machine. So these are the meninges from here to here, subarachnoidal space, 0.6 millimeters. So I wish to draw your attention to the fact that we are able to see in vivo structures that normally are seen during histology, because 0.6 millimeters is 600 microns. 600 microns is something that you see with a microscope. So you can see it in vivo. And then from here to here, you see the neuronal layers of the cortex that were first described more than 100 years ago by von Economo, and that yesterday also were described by Dr. Bradstreet when demonstrating the alteration in autism. So you can see them. Are these gray and white lines that are parallel to each other, and they form the columns. Here you can see one column, micro column. Of course they're micro because they are in the order of the microns. Micro column that Dr. Bradstreet was mentioning yesterday. Now you can see them with a simple ultrasonographic machine. You can further enlarge, and now you go at this picture that was shown yesterday, because it's a common picture from any book of histology, of neurohistology by Dr. Bradstreet too. So these are the different types of staining that allow you to recognize the different layers of neurons in the brain. Unfortunately, this can only be done post-mortem in autopsies. This can be done in the in vivo patient living and awake. So we can measure all these morphological and physiological features whose abnormalities are likely to be reversed by Gcmaf, whose abnormalities are common in a variety of chronic neurological diseases, including, of course, ME/CFS and autism. We can measure the thickness of the cortex. Just imagine how useful it is for Parkinson or Alzheimer. And to check whether any given treatment, holistic, homeopathic, conventional, whatever, changes the thickness of the cortex. Then we can check for the neuronal layer arrangement that has to be parallel, and it is not parallel in a variety of neurological disorders. We can check for the thickness and the organization of the meninges. We can check for the vascularization of the meninges and the cortex. We observed in chronic fatigue syndrome patients an increase in blood vessel flow, just the same that you observe during the thyroiditis, for example, that is suggestive of a condition of inflammation. And of course, after having observed that, you can monitor whether the treatment that you are providing is improving that feature or not. And then we can look for brain movements. So these are the blood vessels in the meninges, 0.1 centimeter, so we're talking about very small blood vessels. This is a supposedly normal subject, which is me, and so we guess that that's the way it should be. These are blood vessels. We're not sure. No, I'm not sure either at all. That's why I'm asking you, so that we can collect a series of pseudo-normal cases.
Look at the white corner there.
Right. Okay, so these are the blood vessels. So here we're talking about less than 1 millimeter, 600 microns. So we're talking about very tiny structures in the cortex. Now, what has to do this? To remember me that I have to talk about movements. I couldn't find a better picture. Movements of the brain. Later on in the afternoon, I will show you that your brain moves. but not only when you have a concussion. It moves at every heartbeat, it moves at every breathing act, every time you breathe. So actually, this was the brain of a colleague of mine. Also, she was supposed to be normal. And so if you just measure the thickness of the cortex, so now you have learned, of the entire brain, from the squama to the white matter, so these are the meninges, this is subarachnoidal space, this is the cortex, and at the end of exhalation, the thickness is 0.73 centimeters. At the end of forced, I must say forced inhalation, the thickness is 0.67. So there is a decrease from 73 at the end of exhalation to 67 at the end of inhalation. It is not a big one, we are talking about fractions of millimeter, but they happen with every breathing act. For example, we saw a patient with multiple sclerosis, and my colleague asked me whether I had frozen the image, as we say in our ecographic jargon. You can freeze the image on the screen when you want to do some measurement. I had not frozen the image on the screen, simply the brain of that woman was not moving, was still. So all these things had been partially described in the past, but you know, the functional magnetic resonance imaging is complex, it's expensive, so people don't play with it, and many of these features had not been studied, but I think they can be studied now easily. And of course, we can see whether in chronic fatigue syndrome there are changes in brain movement, whether the brain is stiffer or not, and whether any given treatment will modify this characteristic. Now, yesterday we heard Dr. Bradstreet describing the very interesting effects of magnetic resonance stimulation of the brain. Now you will hear something which can be parallel, because I will be talking about ultrasound stimulation of the brain. Being an echographist myself, of course, we always fight with people working with MRI, and we say that the echography gives you much less information, but it is easy, it is safe, it is rapid, it can be done just for play. So I will keep on this track. And last year, in the journal of the Invest in Me organization, which is a very prestigious organization of patients with chronic fatigue syndrome, we published in the 1st of June this paper where we described the effects of the transcranial sonography that I just showed you, not only in the diagnosis and follow-up, but also in the treatment of CFS. 2 days earlier, without us knowing this, Hameroff et al., that are scientists working at the University of Arizona, departments of biophysics, in a journal named Brain Stimulation, published exactly almost the same results, independently of each other. Transcranial ultrasound stimulation effects on mental states, a pilot study. So this goes back to Heisenberg's principle that whenever you observe something, the simple act of observing that thing modifies that thing. Therefore, the ultrasounds that we use to visualize the brain somehow modify the brain, and they modify it in a positive way. We later learned that also the Defense Agency for the Advanced Research Project Agency of the United States military, the so-called DARPA, has programs aimed at studying the effects of the same ultrasounds that we use for neurological psychiatric intervention, navigational commands assistance, long-term alertness, wakefulness, behavioral reinforcement, anxiety stress reduction, cognitive enhancement, pain intervention, traumatic brain injury. These are the information that you can find on the military website. Of course, they cannot give you more information, but we have the advantage that they cannot publish their results because of the military secret. And since we are not linked to any military secret, we could publish our results. Just to let you know that this is not something too novel, it's not something too magic, it's something that is funded by the United States government for military purposes. And if the government is interested in increasing the performances of soldiers, these very same effects can be exploited to restore those functions in those patients that have a decreased function in these areas. For example, going back to autism, but of course this applies to chronic fatigue syndrome and I would say to all chronic conditions, a decrease in muscle strength is pathognomonic. This paper was published in the Journal of Strength and Conditioning Research in 2012, December 2012, that is a few months ago, and demonstrates that children with autism have muscle weakness that sometimes is the first symptom, and that if you are able to reverse muscle weakness, then you reverse many of the symptoms.